Pivot turner transfers. The purpose of this video is to instruct caregivers on how to perform a transfer using the pivot turner. The pivot turner is the least restrictive of all of our mechanical lift devices. It does not have any motorized parts and does not rely on electricity. It blocks a patient's knees and has a handle that the patient can use to pull up to stand while the therapist stands opposite and counterbalances. The pivot turner fits well into small spaces such as bathrooms, and because there is no sling component, it works well for toilet transfers. It is light and portable enough to use for car transfers as well. Unlike other sit-to-stand devices, this is for transfers only. A patient cannot be moved from one room to another or across space with this device. The patient must be able to maintain standing with the pivot turner for about 15 to 20 seconds to transfer safely. It requires that the patient has enough strength to pull to stand with their knees blocked and maintain standing with upright posture. It also requires the ability to follow commands, good sitting balance, and good trunk control. The weight capacity of the pivot turner is 400 pounds. Bed to chair transfers. Explain the procedure to the patient and put a gait belt around their waist. The belt must be low around the patient's hips to facilitate bringing the hips up and forward. It will not work as well if you put the gait belt up underneath the patient's arms high on the chest, as this will cause the patient to lean forward rather than stand up. Move the chair that the patient is transferring to as close to the bed as possible, lined up at a 90-degree angle. If it is too far away, the patient may miss the chair as they go to sit. Lock the chair to ensure that it does not roll as the patient sits. Bring the pivot turner close to the patient and have them scoot very close to the edge of the bed. Their feet should be solidly placed on the floor. Slide the base of the pivot turner under the patient's feet. The feet and knees should be in full contact with the pivot turner before the patient stands. Adjust the height of the knee pads so that they are just below the patient's patellas. You could have a second therapist or rehab tech assist the patient to stand as well. Once the patient is standing, swivel to turn the patient 90 degrees to line their hips up with the chair or commode. Cue the patient to keep their hands on the pivot turner and to resist the urge to reach back for the chair. Cue the patient to sit their hips as far back as they can and bend their knees to sit. Once the patient is sitting, tell them to let go of the pivot turner. Pull the machine away from the patient. Chair to bed transfers. When the patient is ready to get back to bed, repeat this process but in the opposite direction. Make sure that the bed is low enough that the patient can sit securely back, rather than on the edge of the bed, and is close enough to the head of the bed that they will not require a boost once they lay down. Precautions and contraindications. Because there is no lateral support, this should not be used with patients who have a severe lean or pusher's syndrome. If the patient has open wounds or incisions, ensure that no rubbing or shearing takes place. If the patient has modified or individualized sternal precautions, cue the patient to lightly put their hands on the bar. Most of the strength to stand will need to be from the legs. They may require a boost to stand. If the patient has mindful moving precautions, cue the patient to keep elbows to their sides as they pull to stand. If a patient has excessive abductor tone, it can cause the shin to shift laterally on the shin guards. The patient may require a strap or gait belt to go around the lower legs to prevent this, or a person to hold the lower leg into a neutral position while the patient is lifted to standing. Excessive flexor tone may prevent knees from extending enough to safely straighten the legs. Monitor tone closely. Ortho patients must have at least 50% weight bearing on the affected limb. Bulky cam boots or casts may not work well with this device. If you are ordering a patient to use the Spasticity at home, beware of home use limitations, such as high pile flooring or thick rugs that may limit the caster wheel's ability to roll.